Hi guys, I'm Martin from Body Limits and I'm going to be running you through a very common injury that we get in our clinic, and it is your tennis elbow. Okay, we tend to refer to it as a lateral epicondylitis, and it's where your epicondyles, which is basically these bony protrusions right around your elbow joint, okay, become very inflamed, tender and sore. Um, Sometimes become difficult to even lift teacup, so it ruins your cup of tea, or again just your normal daily routine in life, whether it's your handbag shopping or just your groceries essentials at the moment. Why have we got this? It can be because you've been struggling locked down to keep the wife happy. She's given you a big long list, which includes loads of DIY, lots of painting, decorating, lots of overuse, working these flexors and extensors, and you find yourself with this problem. So what can you do to help yourself? So that's what I'm here to run you through, some of those top tips. So one thing we want to make sure is we got the full range of movement throughout these forearm muscles. Okay, so we want to be able to elongate, stretch them out. First one for these extensors is arm out straight. Okay, lock the elbow, drop the hand all the way down. You should be able to do this really dead easy, and then simply hook this thumb underneath and rotate through. Okay, we should find we're getting a nice long stretch down through here. Okay, the brachioradialis in particular, nice little stretch through there. We want to be able to make sure we can fully supinate as well. We should be able to do that quite easily, and if we're not, you're stuck there, you're like, oh, can't bring it across, you need to stretch it out again. Fully extend through the elbow, bring it down, and simply stretch on through, okay? And that solves all these flexor problems, okay? Often we know they're very tight, so if you're standing there nice and still and your arms are rotating through quite heavily, it means you've got quite a lot of rotation, and we need to open out your shoulders for one, and again, free off some of this forearm tension. Okay, so good little stretches there. Other things we can do is basically massage them. Okay, so if they're all tight, blood supply is quite poor, we're not getting those nutrients or micronutrients down to help the recovery process, then we need to sort that out and release some of the tightness and tension. So rest it on the table, use your palm, use the heel of the hand, work yourself up through. We can flip it, work the underside, use your forearms if you have to, or if you're fortunate you've got the other half that quite doesn't mind doing it for you, or if you've annoyed her, don't let her, she'll, or him, she'll create too much pain and take advantage of the situation. Okay, we can do a little bit of sort of ringing. Okay, you simply grip and drag across, so a little bit of working the transverse frictions through there, just sort of unsticking all those muscles and cross bridges which have inadvertently formed due to sort of misuse and overuse, and a poor repair process starting to happen. Okay, so we should automatically find it's getting a lot freer, a lot more relaxed through here. We want to be able to get nice pliable movement. Okay, and then things we could do is, so you could order tennis elbow strap, and basically where we get our point of pain, i.e. we'll call it here for argument's sake, we usually go down an inch. That's where you want the sort of the slightly firmer section of the strap, and the rest of it one size fits all. Pull it tight and wrap it round. We don't want to cut off the blood supply, so we can make a fist through there and then check that the blood's coming back to the fingers and that we're not finding our veins are starting to pop out. It's too tight, we're getting a blood flow restriction, so loosen off as tight as you can without that happening. Basically, we should find then when we grip it in and doing other sort of things, it should reduce your pain, so offload it during your daily routines. Obviously we want relative rest, so if we can try and avoid doing certain things with it repeatedly, great. Use your other hand maybe, just try not to do too much that we get it in this hand, otherwise you'll get problems then also. Hopefully that's been a help, not too long, and hopefully see you after the lockdown. Ta-ra.